I am Dr. Bapuji, Chairman of Center for Integrated Medicine from Hyderabad. I am qualified in modern medicine, that is MBBS, qualified in naturopathy, qualified in yoga. I have been practicing for the last 45 years. Today I wanted to discuss about annual checkups, and there is a lot of confusion going on in general public. People are advertising about total body checkup, master health checkup, executive health checkup organized by companies, and that is not correct, because any checkup tests have to be done after examining the patient, and as required for the patient, one has to write the test by a qualified doctor after examining him. Usually MD doctor can examine and write the tests. That is the correct procedure. Now what is happening is, so many tests are done. One company gives 50 to 60 parameters in report, and then concessional charges 1500 rupees, 27 pages, and they are going to villages, towns, and convincing those hut dwellers and middle class and lower middle class people, saying that 1500 rupees you will get 27 page reports. What is the use? I can't understand. So what I suggest is, after the age of 30, both husband and wife should go the test which I am going to dictate here. Why after the age of 30? Because after the age of 30 and people start having sugar, BP, and back problem, neck problem, cardiac issues, they are worried because they keep hearing in the society, somebody had a stenting, he had a heart attack, somebody had undergone bypass surgery, somebody had suddenly died working, and people are so scared. So what I suggest is, there are only few tests which I am going to dictate and explain to you also. This is for people who do not have diabetes, who do not have BP so far. So after the age of 30, both husband and wife should go, and following are the tests. First is CUE, complete urine examination. You can give when you go to the lab. Need not carry early morning sample. It gives lot of information to us. Second one is blood picture, complete blood picture, and ESR. That also gives lot of information. You don't have to know the details about it. Okay? Then fasting blood sugar. Fasting blood sugar means the previous night dinner should be over by 8 o'clock. Next day 8 o'clock you should go and give the sample. 12 hours of fasting should be there. You can take water. No tea is allowed. No coffee is allowed. There are some people who cannot get out of the bed unless they have morning tea, morning coffee. That's not correct. Last night you went for a party at 10 o'clock. You had a booze. You had a lot of sweets and desserts. And in the morning they call people home to collect the sample. That has become a common feature, particularly in elite class. They would not like to go to the laboratory and somebody comes and takes the sample. I have seen an advertisement where somebody is reading the cricket match pitch and narrating on the camera, which is being telecasted. And meanwhile, somebody, while he is narrating, he comes and takes a blood sample, and then that is the advertisement. So people are lazy. So those readings can be erratic. Please don't go for that. And big actors also are advertising about it. That's useless. So fasting blood sugar, 12-hour sample, and only water can be taken. Right? Then comes post-glucose blood sugar. Husband and wife never had sugar. So post-glucose. Post-lunch I am not saying. Post-lunch word itself is not correct, because lunch is taken in the afternoon. They usually go after breakfast. Breakfast cannot be called as lunch. So best thing is postprandial is the correct word, but postprandial also is not dependable for the simple reason. One day he eats idli, another day he eats vada, another day he eats dosa, and the fourth day he eats toast with eggs and all that. There is no uniformity. And once people know that they are going for postprandial test, they will eat less. So best solution for this is the people who are below 75 kgs, they should take 75 grams of glucose. Earlier laboratories used to give, but now they are not giving. Kindly carry 75 grams. How will you carry? Buy a packet of 100 grams of glucose. Plain glucose is not available in the market. Glucon-D will do, no problem. Bring it, dissolve it in 1 liter of water. If you have to take 75, 3/4 of it carry in the bottle. And people who are above 75 kgs, even 100 kgs, 120 kgs, 100 grams is the international criteria. So they have to consume 100 grams. I'll tell you the procedure. After giving the first fasting sample, immediately drink this glucose, 75 grams or 100 grams as I mentioned, and give the sample 1 hour later. Now internationally they check after 2.5 hours to see whether the sugar levels come down to normal. But my interest is to catch the peak. How far up the sugar goes up can be caught only after 1 hour. So post-glucose blood sugar clinches the diagnosis whether this person has got diabetic tendency in future or is he a potential diabetic and so on. Then next blood parameter is blood urea. Blood urea and serum creatinine. These two parameters give biochemical status of kidney function. Okay. Next parameter is serum uric acid. Serum uric acid is usually high in people who eat high protein diet, particularly Middle East countries, they eat a lot of non-vegetarian almost daily or daily 3 times. Most of the Middle East patients, they come to Bombay and Delhi for kidney failure, kidney transplants. So uric acid is a degradation product of protein, and uric acid has to be thrown out through the kidney filters. Now there are 1 million filters in each kidney. If a person doesn't drink water and if uric acid passes through these filters, they can get stuck there and one filter can slowly knock off. 1 million filters. So in each kidney, by the time 50% in both kidneys are knocked off, it is too late. Then blood urea, serum creatinine start going up. So serum uric acid is also known as silent killer of the kidney. So serum uric acid is the one which is required. And then lipid profile. Lipid profile means cholesterol. But one information I would like to give you, latest lipid profile, they talk about total cholesterol, good cholesterol, bad cholesterol, VLDL, serum triglycerides. These are the parameters they show. Now latest information for your sake is cholesterol is not at all responsible for causing blocks either in the heart vessels or brain vessels or kidney vessels or eye capillaries. Cholesterol is not at all responsible for heart attacks. Okay. Then last but not the least, men should undergo PSA estimation, prostate specific antigen, because prostate cancer can be detected early by PSA estimation. And for women, if she had any menstrual disturbances, now at the age of 35-40 they have regular menses. What is important is after sexual intercourse, if she has bleeding or in between periods, say her 30-day cycle is there, after the 5 days the bleeding is over, if 15th day, 16th day or 28th day, if she has spotting, particularly brownish or blackish, then she has to go for pap smear. Every laboratory does, lady doctors are available. To sum up, I will repeat it. Complete urine examination, then blood picture and ESR, that is complete blood picture and ESR, fasting blood sugar, post glucose blood sugar, sample to be drawn 1 hour after. Then blood urea, serum creatinine, serum uric acid, lipid profile, PSA estimation for men, that is for the husband, and pap smear if needed only for women. Now these test reports come. Please go to your local physician, preferably MD qualified general medicine. Show it to him. If there are any abnormal tests in that, further tests can be done. There is no point in doing all the battery of tests, 100 tests. Why? And people are getting these tests done once in 4 months, 6 months, going mad. And some of the reports are erratic. So go to a standard laboratory which has got a good reputation, where if something is abnormal, doctor can counter check with them. Thank you.